most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Okay, today we're going to talk about knee pain. 12 signs you should see a doctor immediately.
How about a dozen?
Sure.
There you go.
Cheaper by the dozen. So if your knee pain was caused by an injury,
Yeah.
so sports, fall, work, and so on, you should seek out medical advice or attention if any of the following conditions exist.
Right. Let's do it.
Number one must be the most obvious.
What's that?
Well, if you have like a deformity, like you have a bone sticking out.
Obvious deformity.
Yeah, right. If you compare the one knee to the other knee and there's something just not right visually.
Right.
Yeah, you may have broke something or dislocated something or.
Yeah. And you got to look around the knee, around the joint line, just below the kneecap. Around you might see a little, if the meniscus is actually torn, popped up, but there's probably going to be some
Well, the kneecap
pain
could
associated.
be over. Right.
Yeah.
Right.
It usually doesn't happen without notable pain.
Number two, if you have significant bruising or swelling. Bruising generally means you've had some artery damage. You know, it's strained on the arteries. The more bruising, the more swelling, the more likely you've experienced a serious injury.
Sure.
So get it checked out.
Typically, with that, the range of motion is going to be painful too, but
Sure.
not always.
Let's say you have difficulty, number three, difficulty walking after an injury.
Oh.
So it's causing you to limp. The intense pain could indicate a bone fracture or a torn muscle or ligament.
Right.
So
in other words, sitting, it's not too bad, and
Right.
maybe you can range it out. But as soon as you put some weight on it, it makes you jump.
yeah. And number four fits right along with that. Actually, we got two number threes, by the way.
Oh, my goodness, a double header.
Let's say we're walking and your knee won't hold the weight.
Sure.
Like you actually
Like it wants to
give way.
give,
right.
yeah, obvious.
That's an obvious sign that you should go see the
Yeah.
doctor.
Yeah, you probably don't want to wait and see if it gets better for a couple of
Right.
days.
Let's say it's not that severe, but it feels unstable or instable. That can often be ligament damage too, or even the cartilage damage.
Right.
It's just not holding in place like it should.
Yeah,
so.
you can walk, but it just feels like it's going to give out at any time.
Yeah.
It's that really queasy feeling.
And this is interesting how often this happens. The next one, you actually hear a popping noise. And you hear a lot of people that say that, well, like especially if they tore their ACL.
Oh, you mean at the time?
At the time.
At the time it happens.
I remember even sometimes people would say they heard it in the crowd.
Yeah.
That they heard a popping noise.
Yeah, I've always wondered, because I always think that sometimes the person who's having the knee thing, they hear a pop, but
Right.
Nobody else can be, because you can feel it.
It's a vibration almost.
Yeah,
Right.
and you associate that. But when they say they hear it, from the
Yeah, a
audience,
crowd, then
the
you know it's
crowd.
the real thing.
I should say crowd, yeah, not audience.
If you have reduced range of motion, so if your knee is not straightening all the way or not bending all the way, again, there's a lot of things going on there that could cause that. One is a torn meniscus,
Sure.
torn cartilage.
So bending just means all the way like
Right.
this, and all the way straight.
It might be swelling, just plain old swelling
Right.
that's stopping it.
Yeah.
But if there's that much swelling, you probably should have it checked out.
Sure.
So if there's less sensation in the knee, so you actually you can't feel part of the knee or around the knee or anywhere, then it could be even sciatic or something non-knee condition.
Right.
But you want to get checked out.
So you touch it, and just feels numb. There's a numb area in the knee.
Now, if you didn't have an injury like a sports injury or fall, but you've had long-term pain or discomfort in your knee, and it's chronic, it's ongoing, you may want to check out a doctor and just see where you're at.
Right. So you injure it. Yeah, you can walk on. It's not too bad. Not much swelling, but it doesn't feel 100%. But it goes on for a week or 2 weeks. I would think
Or
after 2 weeks you should.
Yeah, especially if it's new.
Right. It's
Yeah.
not improving. It's
But
just
if
kind of
it's
hanging
a
out
gradual
there.
onset, you might go several months before you go to check it out.
Yeah,
If you're
some
like
people
me.
are that way.
Yeah, like me, like some people. You and I are both that way.
Well, that's a different story.
All right. Well, we diagnose ourselves.
Yeah.
So, if the knee pain is affecting your daily activities, so you're having trouble doing the things that you've wanted to do in
Right.
the past,
Yep.
obviously have it checked out. If it's affecting your sleep, that's usually a sign that it's pretty serious. I mean, not serious, but you need to get it checked out.
Yeah, if it feels comfortable throughout the day and then, or not too bad throughout the day, but then at night as it really gets sore and it hurts in bed, get it checked out and make sure that you don't have something unusual going
Yeah,
on.
sometimes what that means is it could be as simple as that you overworked it during the day and that the swelling, goes into the knee at night.
Yeah.
So,
Right.
but again, pain at night is always kind of a red flag. You always want to pay attention to it. So, number 11, redness or swelling around the joint. This is something obviously not to mess around with. If you think you might have an infection, you're tender to touch and
It's warm.
it's warm. Very good. Yes, you experience a high fever along with it.
Yeah.
You know,
You got to get that taken care of.
Fast. That's not one you mess around with. That's
Yeah.
one you go in and have it checked out. And the final one, if you have really high intensity knee pain, I'm sure that's going to cause you to want to go in anyway. But don't tough it out. There's something wrong if it's really hurting quite seriously.
The other thing I don't think we didn't mention, especially with that redness or swelling, particularly if you had a knee replacement,
Right.
that's definitely because infections will
Are
kind of
attracted.
migrate to that
Yeah.
artificial components in there, and that's really important.
We've
that
seen
you-
this quite often in our patients, and unfortunately, I've seen it in my family. My mother-in-law,
Oh, yeah.
she had infected knee, and
And she had a replacement.
yep,
Yeah.
he had a replacement. They had to take it out.
Yeah,
And,
I've seen that too with different
yeah.
over the years, and it's
Yeah,
it's
it's more and more
miserable.
common, unfortunately.
I wonder why.
Well,
Just more knees
the bugs are getting stronger.
Oh, sure.
We're not able to fight them as much.
Yep.
So, all right. Well, that's it, folks. This video, by the way, is a part of a series of videos on knee pain. If you want to check out the whole series, go to bobandbrad.com, go to the program section. You'll find our videos on knee pain. Now, if this is early on, they all might not be there yet. We're uploading them.
Yeah, because there's going to be, I don't know, 20 of these or more.
20, 30, 40, 50, probably.
Depends how ambitious Bob
Yeah,
gets with
yeah,
it.
yeah, exactly.
But anyways, yeah, it'll say they're not ready yet. You'll just have to come back. And this is not a 2 or 3 day process.
Yeah, this takes a long time.
Yeah, this takes a number of weeks.
What
so.
else comes with the video, Brad?
Well, Bob, this is a great thing. You have a printout, PDF
Yeah.
printout. Click the button, print it out on your printer. We have a complete, like all these, we have all 12 of these. Are you going to take the misprint out before they go?
Yeah, there's a lot of misprints in this one. so.
But you'll be able to read it and know exactly what the video says. You don't have to go over and look at it over and over and over and see our faces more than once. So
Yep, and
it's a benefit.
Again, no charge.
Absolutely.
we don't
Not even
ask
an email.
Yep. We
Not
don't ask for
even-
anything
That's
from you.
right.
All right. Just ask for your forgiveness.
Be careful.
Be careful.